There is a short list of symptoms that, the moment a patient mentions them, a doctor stops everything and listens differently. Not because they are dramatic, not because they hurt terribly or look alarming from the outside, but because experienced physicians know from years of seeing how serious illness begins that these particular symptoms are the ones that quiet diseases send out first. They are the whispers before the storm. Most patients never mention them. They brush them off. They wait to see if they go away. They assume their doctor would have asked if it mattered. But doctors can only act on what they're told. And if you don't know which symptoms to bring up, the ones that seem small but mean something significant, that information never reaches the person who needs to hear it. Today, I'm going to give you that list. 6 silent symptoms that doctors take seriously every single time. And by the end of this video, you will know exactly what to watch for and exactly what to say. Here is the fundamental problem with how most of us think about symptoms. We have been taught, mostly by experience, that serious illness feels serious, that it announces itself loudly, that when something is really wrong, the body makes sure you know it. And sometimes, that's true. A broken bone is obvious. A severe allergic reaction is impossible to ignore. Some heart attacks do arrive with the crushing chest pain you see in the movies. But the conditions that kill and disable the most people over 50, cancer in its early stages, heart disease, stroke building quietly over months, kidney disease, neurological changes, these almost never begin with loud, unmistakable signals. They begin with something you notice on a Tuesday afternoon and then forget about by Wednesday morning. A strange visual disturbance that lasted only a minute. A heartbeat that felt odd for a few seconds. A patch of skin that changed color. Feeling briefly confused in a familiar place. Small, passing, easy to explain away. But here is what decades of medicine have taught doctors. The timing, the pattern, and the specific combination of these quiet signals carry diagnostic information that is every bit as important as the dramatic ones. Sometimes more so, because catching something at the whisper stage means treating it when it is most responsive, when the outcome is most hopeful, and the options are most plentiful. Every single symptom on this list has a track record of pointing toward something serious. That is why doctors lean in when they hear them, and that is why you need to know what they are. Imagine you're sitting at the kitchen table, having your morning coffee, and for about 60 seconds, your vision in one eye goes blurry, or dark, or you see a shimmer or ripple across your field of view, and then it clears. Just like that. You blink a few times, think maybe you just need to clean your glasses, and move on with your day. That moment deserves immediate medical attention, a sudden, temporary change in vision, especially in just one eye, especially if it comes with even a mild headache or any facial sensation, can be what doctors call a transient ischemic attack, or what is more commonly known as a It occurs when a small clot briefly interrupts blood flow to a part of the brain that processes vision. The reason it resolves quickly is not reassurance, it is a warning, because a significant percentage of people who experience a will have a full stroke within days or weeks if the underlying cause is not identified and addressed immediately. The medical window for prevention after a mini-stroke is short. Hours and days matter, not weeks. If this happens to you, or to someone you are with, do not wait for it to happen again. Do not convince yourself it was nothing. Go to an emergency room or call your doctor the same day it occurs. Every hour of delay is a missed window. For most of us, the scale going down without trying sounds like good fortune. But among doctors, unexplained weight loss, particularly 10 pounds or more, over a period of 6 to 12 months without any change in diet or activity is one of the most universally taken seriously symptoms there is. When the body loses weight that the person did not work for, it is almost always a sign that something biological has changed. The metabolism is running differently. Appetite signals are being disrupted. The body may be diverting energy and resources in response to a process it's managing. Internally, the person has no awareness of unexplained weight loss is associated with a wide range of serious conditions, certain cancers, thyroid disease running hot rather than slow, undiagnosed diabetes, adrenal problems, gastrointestinal disease, and in some cases, significant depression. What makes this symptom particularly important to name clearly with your doctor, not just mention in passing, is that when it is connected to early-stage cancer, the weight loss often precedes other symptoms by months. Finding cancer at that stage, before it has progressed further, changes the outcome dramatically. If you or someone you care about has lost weight without trying and cannot clearly explain it through diet changes or increased activity, bring it up with a doctor and use these exact words. "I have lost weight without trying, and I don't know why." That phrase will prompt the right follow-up. Silent symptom number 3, a heartbeat that feels irregular. Even briefly, the heart beats over 100,000 times a day. Most of us never notice a single one, so when you do notice your heartbeat, when it suddenly feels like it skipped, or fluttered, or raced for a few seconds, or felt like a thud in your chest, that awareness itself is worth paying attention to. Occasional palpitations in otherwise healthy people can be benign, caused by caffeine, dehydration, anxiety, or a single disrupted night of sleep. A doctor will often reassure you, and they may be right. But in people over 50, there is one specific heart rhythm condition, called atrial fibrillation, that often begins as occasional, brief episodes of irregular heartbeat that come and go, sometimes lasting seconds, sometimes minutes, coming once a month, or once a week, then more frequently over time. Atrial fibrillation significantly increases the risk of stroke by a factor that should make anyone take it seriously, and it is frequently underdiagnosed because the episodes are intermittent, because they don't always feel alarming in the moment, and because by the time the patient is in the doctor's office, the heart has returned to a normal rhythm and nothing abnormal shows on the standard test. This is why describing the symptom precisely matters. When you notice an irregular heartbeat, write down what it felt like, how long it lasted, what you were doing, and whether it happened before. That description gives your doctor the clinical picture they need to investigate further, even when the test in the office looks normal. This is the symptom that people are most likely to keep to themselves, and it is one that doctors most wish patients would bring up sooner. A persistent change in bowel habits, going more often, going less often, a change in consistency, feeling like the bowel never fully empties, or noticing narrow pencil-thin stools that lasts more than 2 to 3 weeks without an obvious cause, like a dietary change or medication side effect, deserves investigation. Colon cancer is one of the most treatable cancers when found early, and changed bowel habits are one of its most consistent early signs. Not pain, in most cases. Not dramatic bleeding, though that matters enormously, and we talked about it in an earlier video. Just a persistent shift in what had been normal, and a quiet inner awareness that something feels different. The same applies to urinary changes, particularly in men, where increased urgency, decreased stream, or a feeling of incomplete emptying can signal prostate changes that range from benign and manageable to something that warrants closer monitoring. People normalize these changes. They decide it's what aging feels like. They are embarrassed to describe them, but your doctor has heard these descriptions 10,000 times. It is never embarrassing, and it is always worth saying out loud. Swallowing is something we do hundreds of times a day without thinking. When it changes, when food seems to move more slowly, when you feel a catch or slight pressure in the throat or chest as something goes down, when you find yourself drinking more liquid to help food along, or quietly choosing softer foods because eating certain things has become uncomfortable, That change deserves attention. Difficulty swallowing that is new, that is persistent, or that is gradually getting worse over weeks or months should never be normalized as a side effect of aging. It can be a sign of acid reflux severe enough to have changed the tissue of the esophagus, a condition that is very manageable when treated but can progress to something more serious when ignored. It can indicate a narrowing of the esophagus, and in some cases, it is one of the earliest symptoms of esophageal cancer, a cancer that is among the most treatable in its early stages and most difficult to treat when advanced. A scope procedure, a simple, standard outpatient procedure, gives the doctor a direct view of the esophagus and can identify the cause quickly and clearly. If swallowing has changed, ask for TH.